Hello there, and welcome to Smart Student TV, your only channel that nurtures academic and professional prowess at the comfort of your living room. Today, we explore a topic that is both critical and often overlooked: first aid. First aid is the immediate assistance or care given to a person who has been injured or suddenly taken ill, using available materials and knowledge, before professional medical help can be obtained. First aid is an essential skill that benefits individuals across various roles and professions. Whether a parent, teacher, supervisor, staff member, or laboratory technician, having first aid knowledge ensures preparedness in handling emergencies effectively. First aid plays a critical role in emergency situations by addressing immediate needs and preventing further harm. Imagine, for instance, a mother watching helplessly while her kid is dying from food choking, a situation she would have saved if only she had appropriate first aid skills. The significance of first aid can be categorized into the following key aspects. 1. Prevent the conditions from becoming worse. First aid stabilizes the injured or ill individual, preventing complications or deterioration of their condition while waiting for professional medical assistance. 2. Promote recovery. Early intervention minimizes damage to tissues and organs, potentially speeding up the recovery process and reducing long-term complications. 3. Sustain life. Techniques such as cardiopulmonary resuscitation, CPR, or controlling severe bleeding are life-saving measures that can make the difference between survival and fatality. 4. Relieve pain and suffering. If properly administered, first aid can help alleviate discomfort and reduces anxiety, helping the victim remain calm and cooperative. First aid skills encompass a wide range of knowledge and techniques, including 1. Recognizing emergencies and assessing risks. 2. Managing airways, breathing, and circulation. 3. Controlling bleeding and treating wounds. 4. Handling fractures, burns, and scalds. 5. Administering artificial respiration techniques. 6. Responding to poisoning, shock, or seizures. 7. Safely transporting injured individuals. A first aider is someone who has undertaken training appropriate to the circumstances. First aiders must hold a valid certificate of competence in first aid. The role of first aider is to provide immediate, potentially life-saving medical care before the arrival of further medical help. An effective first aider should possess the following qualities. 1. Calmness. A good first aider must be able to maintain composure even in high-pressure situations. 2. Empathy. He or she must be able to show care and compassion to reassure victims. 3. Observation. He or she must be able to pay attention to details for accurate diagnosis. 4. Decisiveness. A good first aider must be able to make prompt and appropriate decisions. 5. Knowledge. A good first aider must be well trained in first aid techniques. 6. Confidence. He or she must be able to act with assurance to inspire trust. 7. Communication. He or she must be able to clearly convey information to victims and emergency services. 8. Adaptability. He or she must be able to adjust to changing circumstances effectively. The scope of first aid consists of 4 parts. 1. Assessment of the situation. Establishing the nature of accident and prioritizing your operations so as not to endanger your life or to intensify the harm on the casualty. 2. Diagnosis. This is the determination or knowing what is wrong with the casualty based on the history of the case, symptoms, and signs. Symptoms are details of the casualty's sensations gathered from the conscious victim while talking to him or her. Signs are details obtained from complete examination of unconscious casualty using your own senses to the maximum, e.g. by touching, determining the pulse rate, body temperature, etc. 3. Treatment. Treatment should be done immediately and appropriately. 4. Disposal to the house for rest or hospital. First aid is such an important and broad topic to be covered exhaustively in a single tutorial such as this one. However, in today's tutorials we shall only cover some of the most common types of injuries and their first aid procedures. 1. Wounds and fractures. 2. Burns and scalds. 3. Eye injuries. 4. Poisoning. 5. Breathing difficulties. 6. Shock. First, let's begin by discussing wounds. A wound is simply a break in the continuity of the body surface or skin, which allows escape of blood and entry of microorganisms. There are many types of wounds, and they include 1. Incised wounds. These are caused by a cutting by a sharp-edged object, e.g. razor blade or knife, or broken glass. 2. Lacerated wound, caused by rough object, e.g. animal claws, or a saw cutting into the skin. Such wounds are normally irregular and have rough edges and also usually not very deep. 3. Contused wound, caused by heavy object falling on the part of the body, thus damaging the underlying capillaries and hence causing bleeding. These wounds are normally swollen and opened. Bruises normally don't show breakage on the affected skin surface. 4. Punctured wound. They are caused by a sharp-pointed instrument driven into the body, e.g. a nail. These wounds are normally deep with a narrow opening. But what are the general first aid procedures for wounds? 1. Raise the bleeding part at least higher than the rest of the body. 2. Try to stop bleeding by applying some pressure and treat for shock. 3. Clean the wound with antiseptic. 4. Wrap the wound in a clean piece of cloth or bandage. 5. Keep the victim lying down. Next, let's look at nose bleeding. A nosebleed is the loss of blood from the tissue that lines the inside of your nose. The most common cause of nosebleeds is dry air. Dry air can be caused by hot, low humidity climates or heated indoor air. Both environments cause the nasal membrane, the delicate tissue inside your nose, to dry out and become crusty or cracked and more likely to bleed when rubbed or picked or when blowing your nose. Other common causes of nosebleeds include 1. Nose picking. 2. Colds, upper respiratory infections, and sinusitis, especially episodes that cause repeated sneezing, coughing, and nose blowing. 3. Blowing your nose with force. 4. Inserting an object into your nose. 5. Injury to the nose and/or face. 6. Chemical irritants, e.g. chemical fumes at the workplace or other strong odors. 7. High altitudes. The air is thinner, lack of oxygen, and drier as the altitude increases. What are the first aid procedures for nose bleeding? 1. Ask the victim to relax and to sit upright and lean the body and head slightly forward. This will keep the blood from running down your throat, which can cause nausea, vomiting, and diarrhea. Do not lay flat or put your head between your legs. 2. Breathe through your mouth and not your nose. 3. Use a tissue or damp washcloth to catch the blood. 4. Use your thumb and index finger to pinch together the soft part of your nose. 5. Squeezing at or above the bony part of the nose will not put pressure where it can help stop the bleeding. 6. Keep pinching your nose continuously for at least 5 minutes before checking if the bleeding has stopped. If your nose is still bleeding, continue squeezing the nose for another 10 minutes. 7. If you'd like, apply an ice pack to the bridge of your nose to further help constrict blood vessels, which will slow the bleeding and provide comfort. 8. After the bleeding stops, do not bend over, strain, and/or lift anything heavy. Next, let's look at fractures. A fracture is the break or crack of the bone caused by direct or indirect force over the bone. Direct force results in the bone breaking where the force landed, while indirect force caused the bone to break at another site away from the point of impact. There are various types of fractures. 1. Simple fracture. The bone breaks and remains under the skin. Usually there is a swelling at the place where the fracture has occurred. 2. Open fracture. The bone breaks and protrude through the skin. 3. Complicated fracture. This is when a bone is broken and affect a different organ of the body, e.g. a fracture in the rib can cause injury to the lungs or liver. 4. Compacted fracture. This is when a bone breaks and it is driven into another bone. 5. Commuted fracture. This is when the bone break into many smaller pieces within the body. But what are the general first aid for fractures? 1. Make the victim lie down comfortably. 2. Try to stop bleeding if any. 3. Put the broken part between 2 pieces of wood and then tie them up to align the displaced bones. 4. Give painkillers. 5. Avoid touching or squeezing the broken part. 6. Never attempt realigning the broken bones. 7. Dispose the victim to the hospital. Next, let's look at Burns and scalds. A burn is an injury caused by dry heat, e.g. fire, hot metal, etc., while a scald is an injury caused by moist heat, e.g. steam and hot or corrosive liquids. Burns can be classified into 1. Light burn. This is a burn where there is no general disturbance of the skin. 2. First-degree burn. This causes the skin to become red and swollen. 3. Second-degree burn. This causes blisters to open up and release some fluids. 4. Third-degree burn. This involves the destruction of the superficial layer of the skin. The general first aid treatment depends on the nature of the wound. It involves 1. Treatment for shock. 2. Relieving the pain by dipping the affected area in cold water. 3. Excluding air and infections due to air by covering the affected part with clean cloth. 4. Severe burns require immediate treatment for shock. It is advisable to remove the victim's clothes to expose the area affected. 5. The exposed wound should be cleaned with an antiseptic and covered with a sterile bandage, and the victim disposed thereafter to the hospital. 6. For slight thermal burns, irrigate with plenty of water, then wash with a saturated solution of sodium bicarbonate. Cover the area with a piece of bandage soaked in sodium bicarbonate. 7. Dispose the victim to the hospital. 8. For acid, phenol burns and alkali burns, irrigate with plenty of water, preferably in a shower room, and remove the clothes from the area as possible. 9. Bath the affected area with sodium bicarbonate, for acid and phenol burns, or 5% ammonium chloride solution, boric acid or 2% acetic acid, for alkali burns, and then a wet dress is applied over it. 10. Phosphorus burn is highly dangerous and only greasy dressings should be applied. Bath the place with 9% copper sulfate solution and immerse the burnt part in water immediately. Soak in 2% sodium bicarbonate solution and afterwards swab with copper sulfate, followed by further washing with sodium bicarbonate. Another most common type of emergency is that about eye injuries. There are 3 main causes of eye injuries. A. Foreign bodies, e.g. solids and insect. B. Liquids, e.g. acids, bases and organic solvents. C. Gases, e.g. smokes, fumes, dust, etc. 1. For solid foreign particles, never rub the eyes as they can cause further injuries to the eyes. Instead, use moistened linen or camel hairbrush or feathers to remove it. The movement of the brush should be towards the final corner of the eye, which allows the particle to be removed easily. 2. To locate the particle, the lower eyelid is drawn gently and away from the eye. 3. If the eyes are damaged by direct thermal heat or hot metal, a few drops of castor oil should be put in the eye. In case of small metal, irrigate with plenty of water. 4. In case of liquid and gaseous substances, irrigate with plenty of water. Next is poisoning. Poisoning is injury or death due to swallowing, inhaling, touching or injecting various drugs, chemicals, venoms or gases. Poisoning can be through ingestion through mouth, injection through stings, needles or sharps, inhalation through lungs or absorption through skin. Victims of poisoning due to corrosive chemicals will normally show swollen and stained lips. The victim may vomit, suffocate or experience shock. Victims of nerve poisons show convulsion, delirium and become drowsy. The pupil of the eye becomes contracted and the face may become flashed. Before we proceed further, let's look at common terms used in poisoning. 1. Emetic. These are substances given to induce vomiting and to rid the stomach off the poison, e.g. mustard seeds, salt water, soapy water or foam, or raw egg. 2. Antidote. A substance administered to render the poison harmless or to retard its absorption in the stomach, e.g. milk of magnesia for acid corrosion, vinegar or lemon juice for strong alkali. 3. Universal antidote. A substance consisting of 2 parts of activated charcoal, 1 part of magnesium oxide, 1 part of tannic acid mixed together. It's best kept dry until, when required, is given to the victim when the nature of the poison taken cannot be established. 4. Aperient or laxative. A substance given to a victim of poisoning to remove the poison by diarrhea, e.g. castor oil, olive oil, etc. 5. Demulcent. A substance given to a victim after the poison has been removed. It soothes the inflamed membrane after the victim have been given an emetic and a laxative to induce vomiting or diarrhea. It includes milk, water, raw white egg, etc. The first aid for victims who have ingested poisons. Give an antidote, e.g. milk of magnesia for strong corrosive acids, and vinegar or lemon juice for strong alkalis. Immediately if the patient is still conscious. Emetics, e.g. mustard seed, salt water, soapy water or foam or raw eggs should not be given if corrosive poisons have been swallowed. 2. For victim who have ingested alkalis, caustics, and concentrated ammonium chloride, never give an emetic but plenty of water to drink followed by 5% acetic, citric, or tartaric acids. Give few mils of mineral oils after every 15 minutes until 4 doses are administered. Then give an antidote, e.g. milk of magnesia and a demulcent. 3. For victims who have swallowed an acid, do not give an emetic but first give plenty of water, then an antidote, then milk or egg albumin in cold water, then dilute sodium bicarbonate. Keep the victim warm and dispose him to hospital. 4. For victims who have ingested antimony, arsenic and mercury compounds and other insecticides, apply the general treatment. Give an emetic followed by 4 grams of tartaric acid in 50 milliliters of water, for antimony compounds, or 60 grams of magnesium sulfate in 50 milliliters water and freshly prepare iron hydroxide, for arsenic. Give white of egg or milk or cold water. 5. For victims who have inhaled gaseous and fuming poisons. Expose the poisoned victim to fresh air. Do not let him stand, since these will cause poison to spread faster. Administer artificial respiration immediately if breathing have stopped. Keep the victim warm and quiet. 6. For victims who have inhaled halogen gases. Apply general treatment. Administer artificial respiration if breathing have stopped. Allow the victim to inhale ammonium chloride solution. Treat eyes and skin for halogen burns. Take the victim to the hospital. If someone has swallowed a solid food and is choking, you should call emergency services and perform the Heimlich maneuver or chest compressions immediately. Try the following procedures. 1. Have the person try to cough. 2. Bend them forward at the waist. 3. Give 5 back blows between their shoulder blades with the heel of your hand. 4. If that doesn't work, perform 5 abdominal thrusts, also known as the Heimlich maneuver. 5. If that doesn't work, call 911 immediately. If you're the only rescuer, give back blows and abdominal thrusts first, then call emergency services. If someone else is there, have them call for help while you perform first aid. You should avoid giving the person anything to drink, as the fluid could break down the harmful substance and cause it to be absorbed more quickly. Next, let's address the first aid for thermal shock. Its first aid procedures involves 1. Move the victim to a comfortable environment. 2. Gradually warm or cool the body, depending on the cause. 3. Keep the victim hydrated and calm. 4. Seek medical attention. Another common emergency is that due to electric shock. Its first aid procedures involves 1. Turning off the power source if safe to do so. 2. Check for breathing and pulse. 3. Perform CPR if necessary. 4. Treat burns and seek immediate medical attention. Next is first aid for frostbite. Frostbite is an injury caused by freezing of the skin and underlying tissues. Its first aid procedures include 1. Move the victim to a warm area. 2. Warm the affected area gradually using warm water, not hot. 3. Avoid rubbing or applying direct heat. 4. Seek professional medical treatment. Next, let's look at shock. Shock is a condition of severe depression of vital organs of the body associated with poor blood circulation to the tissues. It usually accompanies severe injuries or emotional upset. Shock may result from poisonous chemicals or food, pain, excessive bleeding, stroke, heart attack, etc. Signs of shock include cold or clumsy skin, pale face, rapid or slow pulse rate, chilled feelings, feelings of nausea or vomiting, and shallow breathing. Shock can kill, and it is therefore necessary to save life by preventing shock, though correcting the causes for that particular shock as much as possible. It is advisable to keep the victim lying down and warm with his head lower than the trunk. His airways should be open. Reassure the victim, and give him tea or coffee if the victim is able to swallow. Rush him to the hospital or let him have rest. Next, let's consider asphyxia. Asphyxia is simply the deficiency of oxygen in blood, or the condition in which there is lack of oxygen in the lungs, and these arises from lack of sufficient oxygen in the surrounding. Asphyxia is caused by either poisoning, drowning, hanging or strangulation, blocked throat or suffocation. Its symptoms include rapid pulse rate which slows down thereafter, difficulties in breathing, dizziness and fatigue, unconsciousness, swelling of the neck, etc. Before treating for asphyxia, it is important to first know the cause of asphyxia and to remove the cause from the victim. Then administer artificial respiration immediately, and if in case the lungs are damaged, send him to the hospital. How about assisting someone drowned in water? Do not put yourself at risk to save the person from drowning, or you risk drowning yourself. Once the person has been safely rescued from the water or liquid, check if they are breathing. Tilt their head back. Is their chest moving? Can you hear, see, or feel them breathing? If the answer is no, they are not breathing. Tell someone to call 999. If you are on your own, call 999 after you've spent 1 minute giving them rescue breaths and chest compressions. Give 5 rescue breaths. Tilt their head back, seal your mouth over their mouth and pinch their nose. Blow 5 times into the person's mouth. Give 30 chest compressions by pushing firmly in the middle of their chest up and down. Push the chest hard and fast at a regular rate of 2 pushes per second. If the person starts to show signs of responsiveness, stop compressions and start treating them for hypothermia. If the person shows no signs of responsiveness, continue giving breaths and chest compressions. When someone has been drowning, their lungs may be full of the liquid they were in. In this situation, giving rescue breaths is especially important to provide them with oxygen. In this situation, they may become responsive again once the liquid is removed from their lungs. Next, let's look at the first aid for snake, animal insect bites or stings. 1. For snake bites. Clean the bite. Wash the bite with soap and water. Remove constricting items. Take off any rings, watches, or other tight clothing. Keep the bite still. Try to keep the bitten area still and lower than the heart. Cover the bite. Cover the bite with a clean, dry bandage. Seek medical help. Call an ambulance immediately and transport the person to a health facility as soon as possible. Note the snake. If possible, try to remember the snake's color, shape, size, and type. Avoid these actions. Don't apply a tourniquet, suck the venom out, or apply ice. 2. For insect bites. Clean the bite. Wash the bite with soap and water. Reduce swelling. Apply a cold pack or cloth dampened with cold water to the bite for 10 to 20 minutes. Take medication. Take an over-the-counter pain reliever or antihistamine to reduce pain and itching. Apply cream. Apply calamine lotion, baking soda paste, or 1% or 0.5% hydrocortisone cream to the bite. Raise the bite. If the bite is on an arm or leg, raise it. Move to safety. Move to a safe area to avoid more bites or stings. 3. If you're bitten by an animal, you can provide first aid by cleaning the wound. Wash the area with soap and warm water for 3 to 5 minutes. You can also use antiseptic, but avoid getting it in the wound. Stopping bleeding. Use a clean, dry cloth or bandage to apply pressure to the wound until the bleeding stops. Removing debris. Use running water to gently remove any dirt, hair, or teeth from the wound. Applying ointment. Apply an antibiotic ointment to reduce the risk of infection. Covering the wound. Cover the wound with a clean dressing or sterile gauze. Taking pain relievers. Take paracetamol or ibuprofen to help with pain and swelling. Children under 16 should not take aspirin. However, you should seek immediate medical attention if 1. The bite is on your face, head, neck, hand, fingers, or feet. 2. The bite is deep or large. There is redness, swelling, or pus draining from the wound. 3. You can see an exposed bone or muscle. 4. The bite broke or punctured the skin. If someone is having an asthma attack, you can try these first aid steps. Reassure them. Stay calm and be reassuring. Help them use their inhaler. If they have an inhaler, help them take it. Shake the inhaler. If using a spacer, put 1 puff into the spacer. Ask them to take a slow, deep breath. Press the inhaler once firmly while they breathe in. If using a spacer, have them take 4 breaths from it. If not using a spacer, Have them hold their breath for as long as comfortable. Monitor breathing. If there is no improvement after 4 puffs, repeat the process. Call emergency services. If breathing doesn't return to normal, call emergency services and continue to give them puffs every 4 minutes. Check for injuries. If they are unconscious, check for injuries or give life-saving first aid. If someone is epileptic or is having a seizure, you can help by keeping them safe. If they are falling, ease them to the ground. If they are near a busy road or hot cooker, move them to safety. Remove any objects that could injure them. Place something soft and flat under their head, like a jacket to protect it from injury. Take off their eyeglasses and loosen anything around their neck that could block breathing. After the seizure, gently roll them onto their side with their mouth pointing to the ground. This keeps their airway clear. Stay with them and talk to them calmly until they recover. Time the seizure to track if it lasts more than 5 minutes. If the seizure lasts longer than 5 minutes, seek immediate medical attention or call 911. You should also call an ambulance if the person is having difficulty breathing after the seizure stops. For someone experiencing diabetic emergency. 1. Assess the situation. Ask the person if they need help taking their medication. If they are able to follow simple commands and swallow safely, you can proceed with the following steps. Give them something sugary. Provide 15 to 20 grams of glucose tablets or other sugary foods and drinks. Monitor the person. Stay with the person until they feel better, which should happen within 15 minutes. If their symptoms persist, you can give them another dose of sugar. Follow up with carbohydrates. Once the person is feeling better, offer them carbohydrates like a sandwich, milk, fresh or dry fruit, or dry biscuits and cheese. 2. Seek medical help. If the person's symptoms worsen or they become unconscious, call emergency services. For emergencies involving injury from a sharp which may be contaminated, encourage the wound to gently bleed, ideally holding it under running water. Wash the wound using running water and plenty of soap. Don't scrub the wound while you are washing it. Don't suck the wound. Dry the wound and cover it with a waterproof plaster or dressing. Seek urgent medical advice. Report the injury to your employer. If someone is experiencing cardiac arrest, the first aid you can provide is to 1. Call emergency services. Call 911 or tell someone to call and get an automated external defibrillator, AED. 2. Start CPR. If you know CPR, begin chest compressions and rescue breaths. 3. Continue CPR. Continue CPR until emergency help arrives. Let's briefly look at the procedure for CPR. Cardiopulmonary resuscitation, CPR, is an emergency treatment that's done when someone's breathing or heartbeat has stopped. There are 2 main stages to CPR, the preparation stage and the CPR stage. 1. Preparation steps. Before performing CPR on an adult, use the following preparation steps. Step 1. Call 911. First, check the scene for factors that could put you in danger, such as traffic, fire, or falling masonry. Next, check the person. Do they need help? Tap their shoulder and shout, "Are you okay?" If they are not responding, call 911 or ask a bystander to call 911 before performing CPR. Step 2. Place the person on their back and open their airway. Place the person carefully on their back and kneel beside their chest. Tilt their head back slightly by lifting their chin. Open their mouth and check for any obstruction, such as food or vomit. Remove any obstruction if it is loose. If it is not loose, trying to grasp it may push it farther into the airway. Step 3. Check for breathing. Place your ear next the person's mouth and listen for no more than 10 seconds. If you do not hear breathing, or you only hear occasional gasps, begin CPR. If someone is unconscious but still breathing, do not perform CPR. Instead, if they do not seem to have a spinal injury, place them in the recovery position. Keep monitoring their breathing and perform CPR if they stop breathing. Step 4. Perform 30 chest compressions. Place one of your hands on top of the other and clasp them together. With the heel of the hands and straight elbows, push hard and fast in the center of the chest, slightly below the nipples. Push at least 2 inches deep. Compress their chest at a rate of at least 100 times per minute. Let the chest rise fully between compressions. Step 5. Perform 2 rescue breaths. Making sure their mouth is clear, tilt their head back slightly and lift their chin. Pinch their nose shut, place your mouth fully over theirs, and blow to make their chest rise. If their chest does not rise with the first breath, re-tilt their head. If their chest still does not rise with a second breath, the person might be choking. Step 6. Repeat. Repeat the cycle of 30 chest compressions and 2 rescue breaths until the person starts breathing or help arrives. Next, let's look at artificial respiration. Artificial respiration is simply a method by which oxygen is supplied to a victim of asphyxia. There are 3 methods. 1. Mouth-to-mouth or mouth-to-nose or kiss of life. 2. Holger-Nelson method. 3. Sylvester method. Let's begin by looking at kiss of life. The victim is laid on his back and any debris is cleared from his mouth or throat. The head is tilted backwards and the first aider stands firmly with one leg ahead of the other one and then kneels near the victim's head and draws in a deep breath. He then pinches the victim's nose using his fingers and then tightens his lips over his mouth and blows air through the victim's mouth. When the victim's chest seems to rise, he removes his mouth to allow the chest to relax. This process is repeated several times until the victim improves. This method is, however, not applicable if the victim has taken poison, or there are physical injuries on his face and mouth, or when the victim has poor dental hygiene or the mouth is infected with pathogens. How about the Nelson method? This method is employed when the victim has facial injuries. The victim is laid on his stomach with his arms across his chest and head turned to one side. The first aider places his hands below the victim's shoulder plate and presses hard, counting up to 3 times, then lift the victim and lowers him while pressing the 4th and the 5th time. This is repeated until the victim improves. Finally, let's finish by looking at the Sylvester method. In this method, the victim is laid facing up and some soft material, e.g. mattress, is placed under his shoulder so as to raise him up and allow the head to drop backwards. The first aider kneels under the victim's head facing the victim and grasps the victim's arms at the wrist crossing and pressing them against the victim's lower chest, stretching and pulling them outwards, upwards and backwards as far as possible. This is repeated 15 times per minute until the victim recovers. Finally, let's look at the first aid box and room. First aid box or first aid kit is a small portable box containing essential supplies used to treat common injuries. It contains prescribed appliances like bandages, cotton wool, plasters, various antidotes, emetics, laxatives and emulsants, painkillers, thermometers, forceps, safety pins, etc. On the other hand, a first aid room is a room in an establishment to which someone who is injured or taken ill on the premises can be taken for first aid and to await the arrival of professional emergency medical services. It should be centrally located to serve all the facilities around. The room should be quite clean and well ventilated and under care of a responsible personnel. The equipments in a first aid room include examination couch, dressing table, cold and hot water sink, medical cabinet, oxygen cylinder, sterilizers, accident report book, etc.